So what you are looking at right now are two tools that are used to assess gestational age. The one on the left is called a New Ballard score. Some people will still refer to this as a Dubowitz. It's used to measure gestational age of infants as young as 20 weeks gestation. It assesses 6 external physical and 6 neuromuscular signs. The examination of the infants with a gestational age of 26 weeks or less is usually performed within 12 hours of birth. Any infants who are 26 weeks or more, they usually can perform this test up to 96 hours after birth, so they have a little bit more time that they can wait. The accuracy, what they would like for you to do is whoever has performed the score, they want you to be the one who performs it within the next 48 hours of life. So if you do the initial score at birth and then they want to reassess the tool, they would like for the same examiner to be the one who actually does the score, because it's all very subjective type data. The other thing that you're looking at, which is the tool on the right, is a tool that is used to look at birth weight and gestational age and look to see if the child or the baby falls within large for gestational age, appropriate, or small for gestational age. And they also look at percentiles. We want to make sure that we're either in a 90th percentile, or if they're not and they're falling below the 10th percentile, they need to know why that newborn is not at the weight that they should be for their gestational age. So it's a tool that's used. So for example, if I have a newborn and I am meeting the term weights or normal term infant weights, which are 2,500 to 4,000 grams, that equates to 5.5 pounds to 8.8 pounds. So if I am born at 37 weeks gestation and I weigh 3,000 grams, so we'll just put them smack in the middle, they're about a 7-pound baby. So 37 weeks and I weigh 3,000 grams. This is how they would chart, and you can see that this newborn is within the 50th percentile and appropriate for gestational age. So it's just kind of how they would use this particular tool in order to keep an eye on and to use as another part or an extension of the newborn assessment. So newborns are weighed at the time of birth, and then newborns are also weighed every day until they go home. The newborn will lose weight. This is common. It's not uncommon. What will happen is they request that the newborn is weighed about the same time every day. For a more accurate reading, the scale is brought into the room. You don't have to take the babies out of the room to weigh them. What you will do is put a pad or a blanket down onto the scale. It serves two purposes. It's to prevent contamination or infection, and also to prevent heat loss via conduction. Baby is weighed naked onto the scale. You want to make sure that when you put baby on scale that you're keeping one hand over the baby's chest or abdomen, because you want to always maintain safety. You don't want them to roll off. Normal birth weight we just talked about for a term infant ranges from 2,500 to 4,000 grams. The other thing that is done at the time of birth is a head circumference, a length, and a chest circumference. These are listed on page 587 in your textbook. It goes over that you're actually measuring the head at the widest part, which is your occipital frontal diameter, or just right there above the ears. Kind of use the ear line as the mark, the top of the ears. Term newborn head circumference ranges 32 to 36.8 centimeters, and that is how everything is documented. Weight is documented in grams, and head circumference, length, and chest circumference is documented in centimeters. The length sometimes is difficult to obtain because you've had a newborn who's been in utero, so a lot of times they're curled up. They have not really had that time to kind of stretch themselves out. So what you can do is you actually place the infant on a flat surface and you extend the leg until the knee is flat onto the surface, and that gives you a little bit more accurate length. When we're looking at length, we're measuring from the top of the head to the heel. Those ranges, or the normal range for a normal term infant, is 45 to 55 centimeters. And for chest circumference is typically 2 to 3 centimeters less than the actual head circumference, and average for a term newborn is anywhere from 30 to 33 centimeters. And when you think of measuring the chest, you're measuring across the nipple line all the way around. There is a picture of measuring chest circumference on page 591 in table 23-3.